When I was given this, the question to present here together with Shirley, I thought it's really a little bit strange to have a medical perspective on what it's like to live with Waldenstroms, because I really think this is something that's should all be all about the patient perspective. So what does it mean to live with Waldenstrom? Of course, we talk about it a lot with our patients, but we really need your insights. And that's why we also, again, will use the Slido system to ask also for your own experience. And of course, it's important how can we explain certain symptoms, but more important also, how can we help? So I have some questions for the patients in the audience and on YouTube and also in the UK. And I have some questions for the caregivers or family or relatives who are here with the patients. So if you have a scale of 1 to 10, with 10 being the best experience, how would you rate your quality of life at this moment? So could you think about this and use the Slido system? Do I have to advance the slide now, or yeah? So on a scale of 1 to 10, and so the median score is 7.8. Okay, almost 8, which is good. And you can see some patients have no symptoms. Some have worse symptoms, and they score their quality of life with a 5. So you already can see here that there's a lot of variability. It's going up. From being here in Amsterdam. Very good. And it will be interesting for me to see what it's like as a sort of controlled study, what it's like for the caregivers on the same scale of 1 to 10. Okay, yeah. So you can see there's a point difference between the caregivers and the patients. And some also have a lower quality of life. So the difference is going down a little bit, but it seems to be a bit better for the caregivers. But that doesn't mean, because also when we're talking about living with WM, there's also consequences for the caregivers who have to take care of patients with WM and who support them. So if this is about the patient perspective, it's important that we find out about the patient, the patient reported outcomes, and how do we do that? So we ask when patients visit the clinic for their symptoms, whether or not related to the disease. It's also important what the toxicity is, for example, of the treatment that we administer. So we can see the toxicity sometimes in the lab results, but more importantly, the symptoms. What do you experience yourself? And together, these symptoms that are related to the disease and the toxicity of the treatment determine for a large part the quality of life. Of course, not completely. And it's very important to note, and this has been researched also, that there's really not much concordance between the symptoms that the patients self-report and the symptoms that are perceived by the doctors, which means that the physicians often underestimate the severity of the symptoms and of the toxicity. And you will see in many medical articles, for example, for new treatment, that the toxicity is manageable or reasonable. And I always wonder, what does it really mean? I mean, if you ask the patients, is neurotoxicity manageable? I think it's an awful side effect or symptom. So there's already a disbalance between these two, and that's why it's important to directly ask the patients. And in the group of Shirley de Sa, actually also they did a systematic review of all the questionnaires that are currently used for patients with Waldenstrom. So the quality of life questionnaires. And they found 10 studies where these were used with 14 different questionnaires. But you can already see here that you don't need to see all the different questionnaires, but it asks about different symptoms. For example, your energy level, your physical ability, but also about appetite and loss of appetite and nausea. But they're all very different, and probably they're not very reflective of the symptoms that are specific for patients with Waldenstrom. So actually, we together as a community, together with the patients, we should develop questionnaires which are more specific for patients with Waldenstrom. So again, would like to ask the patients, what is your most prominent complaint at the moment? Do you have any symptoms? Is it like fatigue or weight loss? Is it fever or infections or neuropathy? So if you could, or hopefully you have no complaints, that's of course the best option. Could you use the Slido again? Not sure it works. Okay, do I have to advance? Sorry. Yeah. Okay. Yeah, so that's more or less what I would expect. Thankfully, 25% of you at the moment don't have complaints, but fatigue is definitely the one that we see most often. And the same question for the caregivers. Now, could you also let us know what do you think the most prominent complaint is for your spouse or relative? And again, fatigue comes out as the most strong sign or symptom. So this is a slide that Shirley actually provided, and already we heard also from Dima. In Waldenstroms, you can have a multitude of signs or symptoms. Can be the fever or the weight loss, the feeling of weakness, the lymph node swelling, or the night sweats. And especially these general symptoms like fever, fatigue, and weight loss and night sweats, it's always important to assess, are they actually related to the Waldenstrom? Because there can also be other causes, for example, infection or alternative causes for these symptoms. And that always is, sometimes can be quite difficult to determine. And especially for fatigue, also here it's noted that 70% of Waldenstrom patients have fatigue. It's the most difficult symptom, I would say, to address. And I'm happy there's a special session actually also this afternoon, because it can be caused by the anemia, but actually a lot of patients have fatigue who have perfectly normal hemoglobin levels. So looking at the numbers, the hemoglobin levels, the IgM, doesn't always reflect the symptoms that the patients have. So there's the anemia, of course, can be caused by multiple causes, but also there's something called cancer-related fatigue, which is also seen in other types of cancers. So the other issue is infections. So I would like to ask for the patients, have you had any infections in the last 3 months? And let me see. So about a third of the patients had one infection in the last 3 months, and 25% of the patients have had more than one infection in the past 3 months. It's going down a little bit, but about half of the patients have had an infection in the past 3 months. So that's quite an important point. Patients with Waldenstroms have an increased infection risk. And this is often respiratory tract infections like a sinusitis or bronchitis or even a lung infection. And there are very many factors that contribute to this risk. So it can be the Waldenstrom itself, the bone marrow infiltration causes the white blood cells to go down, but it can also, of course, be the treatment that we give, which also decreases the immune factors. So the low white blood cell count, the low level of normal immunoglobulins, for example, the IgG, the T cells can be low. They are very important in fighting against viral infections. And also, of course, there's a decreased response to vaccinations, which in this era of COVID is especially important, which means that some patients need to take antibiotics for a long time, or they have infusions with immunoglobulin to prevent infections. And COVID-19, of course, is an extremely serious infection risk also for Waldenstrom's patients. And in the past 3 years, this has been really a topic which came up of course, in the clinic, in all the clinics, because patients can have a more severe disease than the general population, and the virus might not be cleared so well. This is also in part the response to vaccination, which can be lower. And this means that still during COVID, many patients still had to take preventive measures, for example, the masking, using the hand alcohol and preventing contact with other COVID patients. And this has led, in my experience, to much distress because patients felt very isolated. They were afraid to see their grandchildren or their children. And this is really something that I think is really an important, also emotional and psychological issue for patients. So fortunately, the COVID, the SARS virus has changed. So the Omicron variant is a little bit less pathogenic in causing disease. And there are some better options to treat COVID or prevent it from getting worse. So it's always important to check in with your hematologist in case you have COVID. So I was also asked to say a little bit about some very rare subtypes of or symptoms that can occur in patients with Waldenstrom's. One of those is macroglobulinaemia, another word which is quite hard to pronounce. And this is what happens in this case is that the antibodies are sensitive to the cold, which means if the temperature goes down, like here in Amsterdam today, the antibodies could clump together, and this can block the blood flow in the small vessels. And this can lead to having these white or blue fingers, which can be painful as well. It can lead to breakdown of the red blood cells, but it can also cause ulcers or skin rash, which can be quite severe, and painful joints. And some of the ways to combat this is just to keep it warm. So move to south of Europe. I don't know if Simone is here, but he will talk later today. It's less of a problem in Italy probably than in Scandinavia. But sometimes you also have, this is a reason to treat the Waldenstrom. And the other point is actually more of the specialization of Josephine and also Annemarie, is called agglutinin disease, where actually the IgM causes the red blood cells to clump together. So I have a pointer, I think. So here you see the red blood cells, and they actually clump together because the IgM antibody connects the red blood cells. And this also leads to obstructed blood flow in the small vessels, which can also lead to the blue fingers, or even sometimes it can be very severe. But also it leads to breakdown of the red blood cells. And unfortunately, we have also better medication to treat this called agglutinin disease. And you can visit Annemarie's poster for a clinical trial that we are going to run in this specific indication. But also here, we don't really have a good symptom score. So one of the projects for Annemarie will also to develop a patient-reported outcome measure specifically for patients who have this called agglutinin disease. And also this was already mentioned by Josephine, and many of the Dutch patients participated actually in the research done by Karima Amador, where we find it extremely important what are patients' preferences for treatment. So it actually wasn't very well known. So we did a survey where we asked patients about specific types of treatment and toxicity, what do they find important in the treatment. And this is called a discrete choice experiment. And actually, some of the results that came out of this experiment, a couple of 100 patients actually participated in the Netherlands, that patients find it important to have a long-term remission. They also find it important not to take medication forever, but they prefer to have like 6 months of treatment. They don't want neuropathy, and I can, of course, imagine that, and they don't want an increased risk of another tumor. So those are some attributes that they find very important. And this is research that we will be taking also with the support of IWMF to also other patients from other countries. And this is hopefully where you will all be able to help us. So I would like to finalize with what are some of the knowledge gaps and challenges. We really need to find better patient-reported outcome measures for Waldenstrom patients, but we also need to do this in our clinical practice, so in a more structured way. And this is important to help us find better treatments. So with that, I would like to thank you for your attention. Then Shirley will continue, and then we will do a Q&A after that. Thank you.